Liberia is one of the first countries in the world to introduce integrated case management of skin entities, including mental health care for people affected by skin entities. Following a request from the Ministry of Health in Liberia, Redress sought to develop a manual and related tools that enhance the existing integrated approach. In this video, we will learn more about this manual from Emerson Rogers, Case Management Coordinator for the Entities Program of the Ministry of Health in Liberia.
Hello, I'm going to take you through the Integrated Case Management Manual, and I'm going to tell you why this manual was developed and also tell you through the various sections of the manual. Why was this manual developed? We've been piloting the integrated case management approach for a couple of years now, and from our experience, we got to understand that people affected by NTDs needed psychosocial support. They needed to be assessed for mental issues, and this was a serious gap in the intervention of the case management approach. So with this gap being observed, Redress research study came in and then tried to study the feasibility of integrating NTDs into mental health. So we went through several stages of developing this manual. We brought all of the stakeholders on board. We had the mental health department representatives. We had Carter Center on board. We had even the community health department on board, the laboratory department on board. So it was the involvement of all stakeholders of this manual that what makes the manual so rich. And then we had several working sections, several technical groups that were set up to actually delve into the ingredients that have made this manual what it is. Okay, let's move on to section 1 of the manual, which would actually tell us what this section contains. Section 1 of this manual contains the master trainer component of the manual. It has in it the introduction of the master trainer, the cascade method that will be used to train the master trainer. We also have an introduction to human resource management and health workforce, the tools that are used for supervision at all levels of healthcare providers. And within the supervision tools, we have supervision tools for ORCs mean officer in charge. We have supervision tools for the district health officers. We have supervision tools for regional supervisors, supervision tools for community health services supervisors, and those are cadre health workers that supervise the community health workers. And then we also have supervision tools for the community health workers. We also have supervision tools for the national or the county entities focal person. So each of the tool is used for a particular cadre of health worker as far as supervision is concerned. And this manual was designed to train master trainers that will be able to roll out the entire module of the integrated approach of case management that includes mental health. In section 2, it has to do with the mid-level health workers training and also that of the lab technicians training. Now, this session is needed because it has to provide the technical skills for mid-level health workers on how to properly diagnose and manage skin NTDs, and also at the point where they are assessing an NTD's patient, they have to assess the patient both holistically, that is including the patient mental status. And that also for the laboratory technicians, they will have the idea as to how to, collect samples and how to package them, how to transport those samples, and even keeping them on the cool chain until they reach the last mile for testing. The content of the mid-level health workers include the facilitator guide, that is part 1. it has also the mid-level health worker pre and post knowledge assessment test, because at this point we would love to understand where the mid-level health workers are when it comes to knowledge gain. The module also has the participant content, mid-level health workers job aid, and a lot of other forms. And some of these forms include the community trick-off referral forms, the all condition algorithm that help the mid-level health workers to serve as a reference document when they are assessing people affected by NTDs. And within that, they have the laboratory sample collection standard operating procedures. That is strictly for the laboratory technicians that form part of the training. And we also have within there the case alert and lab submission form, and 10 tasks for preventing disability in Burundi also. And most importantly, because of the integration, we have the basic psychological support manual that is inclusive within this content, and also its associated tool that has to do with the GAD-7 and the Patient Health Questionnaire 9, that is a PHQ 9. Mental health department is a department by itself. It's a program by itself within the Ministry of Health, and it has its own indicators, right, within the HMIS. So we sat as a team to review which indicators will we need to get into the case management integrated ledger, since we are integrating with mental health. Part 3 is the CHSS content. The CHSS, as it is used in Liberia, stands for the Community Health Services Supervisors. And these cadre of health workers are directly responsible to supervise the community health workers within the community. Within this content, it has two parts. We have the facilitator guide and then the participant content. So the community health services supervisors, who are directly responsible to supervise the community health workers within their various communities, are trained for 5 days. That includes the clinicals of NTDs and also the basic psychosocial support. And then on the 6th day of their training, they are definitely going to be learning how to cascade the training to the community health workers within the community. So section 4 is about the CH8 and CHP content, but the CH8 in the Liberia context means community health assistance, and the CHP also means community health promoters. This content also contains the facilitator guide, and within the facilitator guide, you have the pre and post test questionnaire that are administered to really understand where the knowledge of the community health workers at the point of training. And after the training, we also administered another questionnaire to also understand the impact of what knowledge was gained during the training. So within the part 2 of the content of this section 4, you have the community health workers training materials. We have the community health workers job aid that aid them to do that job in the various communities. We have the community trickle and referral form. And the community trickle and referral form is used to identify cases and then refer those cases to the health facilities for diagnosis. We have the 10 tasks for preventing disability in Burundi also. We also have integrated treatment card that the community health worker also use to follow up on their patients. And there are other forms that are very much unique to the community health workers, and those forms include the routine home visit form. And the routine visit form is used to visit the community health, the patients in their area. And then you have an integrated entities contact tracing form. When a patient is being diagnosed of leprosy or yaws, it is the community health workers' responsibility, along with the community health services supervisors, to do contact tracing of the index case. And these contacts are line listed, screened for possible signs of the conditions that have been diagnosed. Also within this section, the community health worker will have to use the log listing and link method of referring cases, identifying cases at the level of the health facility, and then referring those cases to the health facility. Section 5 of this master trainer content contains the traditional healer, the field healer, and persons affected section. This entire section is all about sensitizing the traditional healers the faith healers and that of the persons affected on how to use the local listing link method, that is in referring cases, identifying cases, and referring them or linking those cases to the community health workers for onward referral to the health facility. They are provided with visual aids and integrated posters to be posted on the walls of their shrine or their various churches. We are aware that people affected by NTDs usually have this myth that their conditions is the result of witchcraft or some other supernatural power. Also within this section, there are areas where we have persons affected. Through these persons affected, we have established a peer support group to support one another based on their condition. And this is one of the first that have ever happened in Liberia through the Redress project to establish peer support group for persons affected by NTDs. And they are there providing psychological support to one another as far as NTDs is concerned. Section 6 of this content has to do with the image gap, and the image gap is the standardized image gap that is being used in Liberia, and we've used it to integrate it with the NTD's case management training manual. If you will need further information on the manual, as I have just explained, please use the contact information on your screen.